Hey everybody, just wanted to let you know that AMP is back in offices and we are seeing some incredible team come together with all the COVID stuff, all the PPE, but I'm hearing something very common I wanted to share with everybody, hopefully give you some insight, that I'm hearing that Profis are too hard, either because I can't use the Cabertron yet, or I can use the Cabertron and the Profi is too hard because it's just, I don't have enough time. And hearing that, my question is, it's a little bit of a stickler question, why is your Profi hard? Could it be, and think about this, could your Profi be hard because perhaps, maybe yes, maybe no, could we have not treated the patient properly prior to today? And what I mean by that is, if they were a 1110, should it have been a 4346? All these numbers. In other words, were we performing healthy Profis on someone that wasn't quite healthy? And it's not that it's right, wrong, indifferent. A lot of times I hear it's because the insurance won't cover it. So my question on the table to everybody out there, hygienists, assistants, front desk doctors, everybody. Are we giving our best to the patient? Are we treating the patient the best we know how for their benefit, not ours, not the insurance company, no one else? Are we giving them the benefit? Here's why I ask. I was in an office recently and a hygienist came up to me and said, Barb, I do my very best for the patient. I've done that for years. I wanted to high five her. I wanted to give her a hug. But then I checked her charts. She hasn't recorded a full mouth probing in 3 years. So how can we be doing our best with that mindset? Now, I'm not picking on anybody, but here's a dialogue I want to share with you. If we are doing our best, what is best in hygiene? Is it a full mouth probe once a year? And how in the world can I do that during COVID? Well, let me address the COVID recovery segment or piece, hoping this part will really give you highlight and insight, and I hope you try it. So if you're doing a Profi today, you've got all your PPE on, it takes forever for the patient to come in, the doctor won't give you more than an hour, you need more than an hour, I don't have time, and then we start compromising what we should be doing. You know, it's not illegal, and the Profi and the SRP police will not come after you if you stop the procedure. Sit the patient up, educate them, be honest, tell them what you see. If you have a camera, my goodness, take a picture. Put the picture up, wait till it's bloody. Wait till the tartar is like floating in the pile of blood. Take the picture, make it big and giant. If you have a gigantic view box to show it on or a gigantic TV, show it. Sit the patient up, do the procedure that day. Do not probe if you don't have to. Hear me out. Not that you don't have to. If you find that you don't have time to probe, do what you can to gross debride them. Get them as healthy as you can superficially. You know what that means. If truly you can't probe, you don't have time, you can't breathe, you can't see, sit them up. Tell them. Elongate your time for the time you have back instead of busting your hand and your back and your neck. Finishing disappointed, the patient is not healthy or they don't know it, sit them up. Say 15 minutes. Use a whole lot of this. Muscle. I said that to the hygienist and they said, do you want me to clench more? And I said, no. But if your hands, neck, and back hurt at the end of the day, ask yourself why. There's no reason for that. Am I providing the best care for the patient? If I'm doing a Profi and it's all full of blood, do I show them? Do I take an intraoral and show them? Because you and I both know they can be dripping with blood and the patient will sit there and say, oh, am I bleeding? Show them. Put the fear in them, or the value in them, better said, the value in them. The concern that you have for the license you have and the education you've earned. Share it with them. Sit them up. Mr. or Mrs. Patient, you're not healthy today. Take a look at this picture. I did my best today for the time that I had. You were due for me to take all your gum measurements. If you haven't done this in years, this is the time to prep. It's important for me to take your gum measurements so we can decide the interval of when you should come in. The way that you look today, we have a couple of options. I hope you choose the best, because if you choose the best, you'll be the healthiest, and I'll be the best to provide that for you. Completely honest and true. So the best is, here's what I see today. You've got some Name the number. 5 millimeter pockets in the back. I can tell because I spot probed. I put my measurement device in there and I found that I didn't record it. By the way, we're going to document all of this at the end. My concern for you is to complete a cleaning today. First of all, don't have enough time for what you need. You're not healthy today. I would like to offer you to come back one of two ways. I'd like to see you again in 2 or 3 months. Make it a 43, 46. In those 2 or 3 months' time, I am going to show you how to brush better, show you how to floss better. Because if we say to the patient, do you brush and do you floss? Oh yeah, I do it better. How can you measure that? Now all of a sudden you have time. Encourage them. Say, I know you're flossing every day. We know they're not. I know you're flossing every day. Here's a reminder of what it should be. And if you hug that floss around the tooth and you go down to the attachment, if it's a 3, and it hurts them, they are not flossing properly, tell them. Say, hey, a 1, 2, or 3 means that you can reach this and clean it at home with floss. If it hurts you now, it takes about 10 days not to hurt. And in those 10 days' time, I will be far away from you. It will hurt and you will not have nice words about me. But about in that 10th or 11th day, your gums will not hurt anymore. They won't bleed because the epithelial regrowth in that pocket has happened and those cells have regenerated healthier. We know that from our training. Tell the patient that this bacteria must be removed to the attachment once in a 24-hour period. Don't say floss once a day. Once in a 24-hour period. Doesn't matter if it's morning, noon, or night. Once in a 24-hour period, floss properly. That's proper floss. Now, as far as a toothbrush, I know you know how to brush. I'm going to go around your mouth and I'm going to go very slow. And when I'm all the way done, you tell me if that's the way you feel. So I want you to sense the feeling of when I'm brushing your teeth, if that's what you do at home. Go around and brush your teeth. Take your time. Go around their mouth. When you get all the way done, ask them, how does this compare to how you do it at home? Listen to what they say. That's exactly the same. Okay, continue it. I don't brush like that at all. I don't go slow. I don't go fast. I don't do this. I don't do that. When they say I don't, listen and come back and say, try this method. Would you like to try it in front of me while I'm watching? And they say yes or no, whatever, but you have the time. Next part of this is, hey, I've showed you how to brush. I've shown you how to floss. It's frequency and technique. Think about that. How often are you willing to floss? How often are you willing to brush? Minimum on both. Floss once in a 24-hour period to the attachment. You now know what the attachment is. Brush twice in a 24-hour period because over-the-counter toothpaste about every 12 hours will continually kill the bacteria bugs, not like a prescription that we'll talk about in just a moment, but you will do your best twice a day. When you go brushing from once a day to twice a day, you decrease the ability of decay by 40%. If you brush a third time, it's 1%. A fourth time, it's 1%. A fifth time, it's 1%. So the big one is between 1 and 2. So we want you to brush twice in a 24-hour period. It's not more important at night. The bacteria don't grow exponentially at night. The oral cavity is quiet at night, but it's the cumulative period of a 24-hour period. So minimum brushing twice a day. I just showed you how. Flossing once a day. Now here's the other part. If we were to see you again in 6 months, I believe in my heart this will not heal. It's up to you. If you're insurance driven and you only want to do what your insurance will cover, the policy that you chose with your company, notice those words, the policy that you chose with your company does not allow your oral health to be healthy for our standard of care. No insurance does. So if it's your choice, we'll love you just the same. My job is to get you healthier and to provide options for you. So one option is to brush better, floss better, the way I showed you, more frequently, frequency and technique, and come in 6 months and try it. If you look great, great. The odds are you won't. The alternative is to come in 4 months. Let me evaluate you in 4 months, and in that 4 months period of time, you're doing your best at home to keep the bacteria off the tooth, out of the oral cavity the best you can with brushing and flossing, frequency and technique, twice a day for brushing, once a day for flossing. In 4 months' time, I'd like to reevaluate, and here's why. If we wait 6 months, the bacteria that has made wreaked havoc in your mouth thus far today, although you're going to be brushing and flossing better, can revisit you in 6 months, and then you could become a periodontal patient. Whole nother story. If we see you in 4 months and it hasn't improved, great that we saw you in 4 months. Your insurance won't cover another one. They will not pay extra for you to stay healthy. If you want to invest in yourself, please come in more frequently. It will cost you maybe one prophy a year. If they pay for 2, you pay for 1, you get 66% off. Think about it that way. But if you were to come in one more time a year and stabilize and stay healthy, would that be worth it to you versus being a periodontal patient that needs non-surgical periodontal care, 3-month recare, the insurance doesn't cover it, you could lose your teeth? It all starts with when things don't look good. During this COVID time, I see it as an incredible time for hygienists, all of you all over the country. Stop the craziness. Stop. Don't let your hand, neck, and back hurt. Stop stressing. Do what you can to get the superficial tartar off the teeth, polish the teeth, sit them up. My hope is that you have 15 minutes plus to educate, reroute, redirect. Now here, before I talk about perio, I'd like for you all to dream, hygienist. I'd like for you all to dream, really dream, about what it would be like every single day to leave the office at 5 o'clock or whatever time you leave, 4 o'clock, 8 o'clock, 9 o'clock, doesn't matter. But to put in a full day's work, and at the end of the day, your jaw muscles are tired from education and your hand, neck, and back do not hurt. Hygiene's a tough job. If we provide what we learned to the patient through time, even if, and ask the doctors if you could do this, cancel that prophy charge time. Just charge a fee of some kind for your time. Sit the patient up. The odds are great if you educate them and they come back more frequently. What would your life be like if your patients at any age that were bleeding came in 3 times a year instead of 2? They would be more healthier. I hear a lot of kickback that, oh, my patients won't do that in this part of the country. They can't afford it. Well, that might be true. But it might be your judgment if you've never asked them. If you've never provided the value for them to not be diseased, to be healthy, to have a better assurance of keeping their natural teeth the rest of their life and enjoy the pleasure of chewing, they might say, yeah, I could afford one more time a year. Try it, please. Now, when we get to the patient, especially during COVID, they're a literal mess. Hygiene-wise, they're a mess. They're a post-perio patient. They're late for their 3-month recare, and it is just, the pocket depths are increasing. It's a bloody mess. You're stressed out. You want to get them done. You're late seeing them because of all the COVID check, all the temperature stuff, all the stuff you got to put on, all the stuff you have to have in the room. Evaluate them. Get them in the chair. Perhaps do a full mouth probe. Take your time. By the way, guys, when you full mouth probe, anything over a 3, you should probe quarter speed. Here's what I mean. Here's the dialogue. Mr. or Mrs. Patient, hey, I'm going to take your gum measurements. Just a reminder, say it every time. A 1 or 2 or 3 is where you can reach with your floss at home if you're flossing properly. If I haven't shown that to you before, I'll show you today because I want you to know it's proper. A 4 or above, I want you to pay really close attention to because that means that things are breaking down and you have disease and or infection. No worries. I'm going to lay you back. I'm going to explain everything. And then you fish hook them with your mirror and you go to the distal buccal of number 2, and if it's anything but a 3, stop and have this kind of dialogue. Oh, sorry. I that's a 5. That's a little tender. I'm going to go really slow. I'm so sorry because when it's a 5, there's all kinds of things happening. I'll explain to you in a minute. And you'll say 5, 4. Oh, you're on the mesial too. So sorry. 5, 6 again. So sorry. I know that's tender. 5, 6, and then you get all the way around to the canine. When you get to those 3s and 2s, speed it up. 3, 2, 3, 3, 2, 3, 1, 1, 2, 1, 1, 2, and then you get to the 4, stop. Regroup. What the patient will hear, because you set the stage for them in the beginning, what they are going to hear is, oh my gosh, she's going slow, it's going to hurt, above 4s, it's disease, it's infection, oh my gosh, am I going to lose my teeth? So if you sit them up and you say, hey, what'd you think about that? Really, truly, not being a smarty pants, but just curiosity. Hey, what did you think about that? It will range anywhere from, I don't know what anything means, to am I going to lose my teeth? And if you get the am I going to lose my teeth, please answer, not if you do treatment, because that is the truth. Put your big girl panties on, put your big boy panties on. Tell them the truth. They came for treatment. If they say, I have no idea what that means, stage is set. Well, I just want you to know, the areas in the back have deeper pockets. It means that you've lost some bone. It means that the periodontal organism or periodontal disease is active. No worries. We can help you with that. We can't undo it, but we can stabilize it. Here's an analogy about what's going on in your mouth. Say this person's 50 years old and they have posterior sixes. How long do you think you're going to live, Mr. Patient? 80, 90. Well, you have 30 to 40 more good years of chewing. If you were to choose not to do treatment, it's always your choice, but your teeth won't last. And when you start taking teeth out, it starts with that first tooth. And dentistry doesn't hurt. The periodontal disease doesn't hurt. It's kind of like cancer. It's not cancer, but it travels like cancer. You have it, cancer. You don't know. You're either diagnosed or you die. Periodontal disease is, a little bit of blood on your toothbrush, but it doesn't hurt, so you don't think it's bad. And then it progresses and progresses until you visit a hygienist or a doctor or a dentist, and they say that you have this disease, but they don't share what they know, and you don't gain the value, and you don't really care because it doesn't hurt until you start losing teeth. And once you have that first tooth out, you're on a journey to have more teeth out. And once you have that first tooth out, there's a difference in chewing. You'll either throw your food to one side and not say anything, or you'll just choose to not have certain foods. And what the good Lord has given us is anchored in your bone deep, and your teeth are tough. They're 10 times harder than bone, and they can withstand the power of chewing. Help us to help you keep your natural teeth. It's not a matter of money. It's a matter of value. Give them the value. So you got your periodontal patient in, and it's a mess, and you got posterior 5s and 6s, but they've always been a 1110, and they've been a patient forever. And in this part of the country, they can't afford anything past their insurance. Garbage. It's COVID. Use COVID. Sit them up. And this is true, but I say use the leverage of COVID. I should say that better. Use the leverage of COVID. And what that is sit them up and explain what the 4s, 5s, 6s, maybe 7s mean. And we all know as clinicians, the deeper the pocket, the stronger the anaerobe, the faster the breakdown. So a 4 is not going to break down as much as a 7. A 7 is hyper on a road of breakdown. So evaluate what the numbers are and share with them that it's always their choice to say no. And share with them the value that you were trained. That could sound something like this. What's going on in your mouth right now, if we could just magic wand the moment and throw insurance out the window, because I'll get back to that. And the reason why I say that is because if they're insurance driven and you're talking about treatment, they're going to stop listening. But if you say, hey, just for the sake of the argument today or the conversation, let's throw insurance away, magic wand it, we'll bring it back. They'll be all ears because they kind of won't care. So come back to that and say, ignoring treatment would promote you to lose teeth. Bigger than that, though, Mr. or Mrs. Patient, this is a systemic infection. It's blood, it's in your saliva, you swallow the saliva. It can make you immunocompromised. We do know with COVID that those that were immunocompromised got hit the hardest with the virus. So even if you weren't going to do this, please do it because of COVID. Because if we can get your mouth healthy, we can fight a systemic problem that will promote your immunity. And when your immunity is the best it is orally, that follows in your body. So these procedures are, and here's how I like to do it with my hands. If this is the procedure, SRP, and this over here was the maintenance or the 3-month recare, this part, Mr. and Mrs. Patient, is much more important for stabilization than this, which sounds a little weird because this is the treatment. So we treat you here. It's 2 appointments, hour and a half apart. It's a comfortable procedure. We don't do it unless you're comfortable. Don't say shot. Don't say numb. Just, it's 2 appointments, hour and a half apart. We'll get in there and we'll get everything as clean as we can, and we're specially trained to get underneath the gums. It's a specialized procedure. Give yourself value. When you're all done with that, we want to see you every 90 days, and here's why. the type of bacteria that it is will regenerate in 90 days. And in 90 days time, 89 to 91 days, almost on every report or data that you will see, all the research shows right about 90 days that periodontal organism gets real happy down in that anaerobic pocket where there's no air, and it will start breaking bone down again. Here's what I hear again all over the country. Well, Barb, in this part of the country, patients can't afford it and we just do what their insurance covers. I hear it everywhere. They might not do it, but they'll always not do it if you don't offer. If you offer what's right, they'll likely choose it, I promise. So I'd like for you to just try totally accept no. And look at them and say, you've got this problem. I've explained the non-surgical periodontal therapy. Please don't call it deep cleaning. It devalues you. The non-surgical periodontal treatment that I'm licensed to do for you, and then the maintenance behind it. The maintenance behind it, I don't know about your insurance, but say your insurance covered 2 of 4. A lot of people come in 2 times a year instead of 4. And what that does, if we extend this 3 months, we retreat sooner. The treatment that we do, the non-surgical periodontal therapy, is palliative. Palliative means it's kind of like diabetes. A diabetic is always a diabetic. You have insulin to stabilize it. If your insulin is 70 units a day and you're stable, we would never want to go to 30 units a day because it would throw you out of stability. Same thing with periodontal disease. Here's the procedure. Here's the maintenance part. You're always going to have periodontal bugs in your mouth. The maintenance part is every 90 days. If we extend the 90 days, we're going to have to retreat. We have to retreat anyway. But we could choose to retreat years down the road or months down the road. The insurance companies have started to say, well, your periodontal work can only be done every 2 years. But what if you have the kind of body and immunity that your periodontal work has failed in 18 months and you wait the 2 years or 3 years or 5 years? You're not only putting yourself in a potential situation to lose teeth, but you have a systemic infection that can cause your immunity to be immunocompromised, and who knows what's out there. Right now it's COVID. It might be something else. So emphasize this on the treatment onset, not when you're done with SRP, because when you're done with SRP, we don't want to surprise patients. So prior to treatment, this is the SRP, this is the commitment. Mr. or Mrs. Patient, are you willing for the commitment? Because if you're not willing, almost don't want to do this, which sounds weird because it's disease that's got to be treated, but I don't want to do all the work and fail, and I don't want you to have to pay all the money and fail, and ultimately you lose your teeth. This is a very serious situation. My hope would be that you would choose treatment, choose the 90-day recare, and disregard or consider your insurance a little bit of help because you want to save your teeth. This is a mechanism for you to save your teeth. So that's that dialogue. Other dialogue is for the periodontal patient that's coming in 3 months and they're not stable. Again, I can't tell you enough. All over the country I hear, well, they can't come in anymore because their insurance won't cover it. I promise you, it's not against the law to shorten a 3-month recare. If they are unstable, and here's what I mean by unstable. 3-month recare, it's a $49.10. I surely hope that you are recording their probings every single appointment, because if Mr. and Mrs. Smith are there at the same day and they're married, and Mr. Smith has a healthy mouth prophy and Mrs. Smith has an unhealthy mouth prophy or a $49.10, and they go home and they have the same conversation and one costs $100 and one costs $250, they're going to be picking the phone up going, hey, how come? But if you have educated them, if you have used this, if you have shortened your appointment and educated them, set them up, give them the information for them to choose, document it. And when their 3-month is failing, you tell them. You take an intraoral picture and show them. Then you take the periodontal probe and you have them feel. They can feel, you're holding the probe, but they can feel the grain and the grit and the tartar growing on the root. They can feel the bumps. And you tell them that and you show them the blood and you have them choose. We're in a crossroads, Mr. Smith, Mrs. Smith, whatever, Mr. or Mrs. Patient. We're in a crossroads right now. It looks like you're breaking down a bit. It looks like your mouth is a bit unstable today. There's one of two things we can do. You're right now coming in every 90 days. We can choose an 8-week time for me to get in there and to really check. In the meantime, I'm going to show you again, brushing and flossing. Make sure that you're doing it properly. But in 8 weeks' time, I want to evaluate instead of 12 weeks or 3 months. In 8 weeks' time, I want to get in there and I want to stir that bacteria up, and I want to evaluate if a shorter period of time will keep you more stable, because if it doesn't, we have to retreat. That's one choice. The other choice is, hey, we have to retreat. So depending upon, and depending upon what you see, please just sit them up. Cut the appointment short. Tell them you're cutting it short. Sit them up and explain it. You hygienists out there know what's right. You've been trained. Here's what I hear, and part of me can't blame you, but my job and the job of us, all of us coaches at AMP, are to help you break your habit. And truly, if you're in a place that patients can't afford it, let them choose. I had an office in Brooklyn, New York for a year that was a 100% Medicaid office. And when I had the doctor, he had all the bells and whistles. He had the CEREC machine. He had the cone beam. Almost 7 years ago now, so it was really new at the time. He wasn't using any of it because he said his patients couldn't afford it. And at the end of our year, patients were saying yes to implants. Medicaid patients, because we gave them a choice. Not everyone will say yes. But if you offer 10 patients better treatment, will 10 say yes? Maybe, probably not. What if 5 do? What if 6 do? Here's your life as a hygienist. You've shortened their recare. You've shortened their 4910. They're now stable. They're now coming in every 8 weeks. It doesn't matter how many times a year. We'll bill your insurance. They'll cover what they will. They're willing to invest in themselves to keep their teeth, and you leave no longer with your back, your neck, and your hand hurting. Because they shouldn't. And if your 6-month prophy gets too hard but they don't have bone loss, the police are not going to come, the sirens are not going to alarm if you offer them a 4-month recare. But keep in mind, do that for life. Because if your prophies are easier, you're going to be able to educate more. So that's all about that. The other thing I want to leave everybody with is, if you have an hour for a patient, how much of that hour are you quiet? Because if you have an hour of opportunity, are you using that opportunity to educate them? And are you setting the stage for them to be successful as well as you? Because if we use insurance that, their insurance won't cover it, I'll just do a prophy and go deeper, and they have 5s, because a lot of times I'll read in charts, because when I'm in the office I'll spot check charts, and if I see probes at 4, 5s, and 6s, and I see no dialogue, and then I see them at a 6-month recall, is that best for the patient, truly? If it's take away money, take away insurance, is that best for the patient? Did we do our best? Like the hygienist told me recently, I do my best, but she hasn't probed in 3 years and recorded it. Now, she might have probed, I don't know, but she hasn't recorded it. Is that our best? So I challenge everybody out there, get everybody immunocompromised, keep them healthy, stop your prophy, sit them up, and educate them. Good luck.